Well, this is exciting. Welcome, everybody. I'd like to also welcome, we're live streaming this right now at king5.com and the King5 Facebook page, so I'd like to welcome the audience watching on the platforms of King5. You might be tuning in and saying, big deal, this is World Polio Day, why should I care? I'm going to start out and just answer that question off the bat and say, at one point in Seattle's history, it wasn't that long ago, that polio was the fear of every parent, of every family. They were terrified that their kids would get polio and would be paralyzed by this terrible disease. Well, because of immunization and a good healthcare system in this country, polio as a threat ended a long time ago. But it's still a threat in other parts of the world, and we'll get into that with Dr. Wenger in just a second here. So we should care because when we end polio, and we're this close to ending polio, only the second time in human history that we've ended an infectious disease. Smallpox was first, polio is going to be second. But when we end polio for good, we're going to end the threat that it poses to us here in the US. And we're also ending something that has just decimated economies around the world over the decades. We're very close. So that's why we have Dr. Wenger here to get an update on World Polio Day to see where we are. So let me give a little introduction about this man here. Our guest is one of the world's foremost experts on polio. Dr. Wenger has worked on the front lines against this disease for decades. Since 2011, Dr. J. Wenger has served as the director of the Polio Eradication Program at the Bill and Melinda Gates Foundation. Prior to that, he worked at the Centers for Disease Control and Prevention and the World Health Organization. So, you are an epidemiologist. For we lay people, that means he's part doctor, part scientist, and part sort of private detective. It's great to have you here.
Thanks a lot, Mark.
Thanks, Dr. Wenger. So I want to start out just really on a basic level because maybe today, especially on the live stream, a lot of people may not know what polio is. So what is polio?
Yeah, thanks, Mark. I was going to say, that's a lot of parts I am, apparently, so I hope I can hold up my end. Polio, and again, this may be something that's familiar to some of you because you actually can remember it, but maybe a lot of you just read about it. As Mark said, in the olden days, back when actually I was born in 1955, polio was a big threat. And in the United States, it was probably the most feared infectious disease around. People used to shepherd their kids inside during summer and the fall to make sure that they didn't get exposed or go swimming someplace where they, quote, might get polio. And polio was a disease that at that point may have carried a death sentence to it. It's caused by a virus, which usually little kids will take in by something they eat or drink. The virus goes into the stomach, it reproduces, and then they poop it out, and if it gets into water that's around, whether it's sewage or a lake or something, another kid can swallow it and pick it up also. That in itself isn't so bad. The bad part is, in some kids, when the virus gets into their stomach, it then jumps across and gets into the blood, and it can get into the blood and then find its way to the nerve cells along the spinal cord. And when that happens in some proportion of those kids, it will kill those nerve cells. And what that does is then paralyze the muscles that the nerve cells go to. So what you would commonly see is somebody who could walk yesterday but then got a fever overnight and the next morning was weak and the next day he couldn't walk. Or she had a weak arm and it stayed that way and couldn't use it anymore. The worst case analysis, the worst case situation, of course, is if the virus would strike nerves that would affect the muscles that you breathe with. And if you can't breathe, you die. In developing countries where there's no respiratory support, those children die. In the United States, if people were caught soon enough, they could end up on respiratory support, but those are the pictures of the iron lungs that you used to see back in the late 40s and early 50s, where you would sometimes have entire hospital floors or gymnasiums covered with these machines that kids would go into or adults would go into, and it would breathe for them. That was a big problem, and that picture of polio as something that could strike anybody, even somebody who would become the president of the United States, a rich person, to a poor person. it didn't seem to matter very much in the United States, and that fear really drove a lot of efforts to develop something to get us out of this big problem.
So that's a good snapshot. Polio actually is 3 different viruses, right?
Yeah, that's right. When we talk about wild polio virus, which is the virus that's been around since the Egyptians and way before that, it comes in 3 flavors, type 1, type 2, and type 3. And so when they made the initial vaccines, they had to make a vaccine that had each component in it.
So just to give you guys a little bit of perspective, and especially those watching on the live stream, we've made incredible progress over the past 30 years. So in 1988, about 350,000 polio cases occurred worldwide. So 350,000. Last year, there were 22. Think about that. And that didn't happen by chance. It happened because of a massive coalition that included Rotary and governments and health organizations to deliver polio vaccine to as many kids as possible on the planet. Jay, give us an idea of how many cases we've seen this year so far and kind of where we stand, where they are.
Yeah, well, the progress this year is that we haven't seen any wild polio virus cases in anywhere except 2 countries, and that's Afghanistan and Pakistan. A year or 2 ago, we were also worried about Africa, but it seems like that's been patted down in terms of wild polio virus. So we think that we're dealing with virus only in that area. Unfortunately, we've got about 20 cases this year so far, so we're sort of running at a level that's very low, but still there, and that's actually the issue. It doesn't actually do us. We're not shooting to go from 300,000 cases to 20. We need to get that last bit done, and once we can get rid of the virus from those populations and from the sewage that they feed into there, then the world will be free of wild polio virus, and we will not have to worry about any kid getting paralyzed from wild polio virus again.
Yeah. I'd like to go to some slides that we have to help support what we're talking about. So the vaccine started in 1955. The fact that it ended as a threat, Jay, here in America speaks to the strength of our health system, right? And when we talk about why it's still alive in other parts of the world, it really is an infrastructure problem, right? The health infrastructure in some of these other countries is just not what it should be, right?
That's right, and as we see, the picture, if you can see here, is from a paper in 1955 when they announced that the Salk vaccine worked, and that was the injectable vaccine that was the first one to come through. The second picture is a picture of the oral polio vaccine, which is the drops, and which is, if you've been involved in any of the programs that operate in the developing country, you use the drops to try to get rid of the virus. And there are pros and cons about each one of those vaccines. But in wealthy countries like the United States and like Western Europe and places with infrastructures and with the capacity to give vaccines, the virus went away pretty rapidly. So in the United States, we went from having 40 to 50,000 cases a year to having 10 without a whole lot of extra work. It was a lot of campaigns were done, but it was basically taken care of in a couple of years. And that was the picture from 1955 on through about 1988. But at the end of that point, we were at a period. We had a picture of, in the developed countries, the rich countries, polio was gone. But in the developing world, in Africa and big parts of Asia, and even some remaining parts of South America, we still had the virus circulating. So in the poor areas without the infrastructure, the virus is still there, which was obviously a threat for them, but even created a threat for the other countries because it could always come back.
So we have a slide that talks about the Global Polio Eradication Initiative. Explain to us what that is. In 1988, this was launched. How important was this to ending polio?
Well, that was the launch of the polio global eradication initiative was key to getting us to where we are now. And it was right at that stage that I mentioned. It was a period where we'd have polio vaccines for 30 years, and they were working great in places that could give vaccines to kids, but they weren't working great in places that don't get vaccines. So most of the developing world was still suffering from a lot of polio. it was actually Rotary played a huge role in pushing this forward, and Rotarians noted that with some activity, some extra campaign activity in places like the Philippines and whatnot, you could actually drop the virus down even in developing world, and that linked with success in Latin America led the world to say, look, we don't want to just have a world where only rich kids are protected from polio, but actually kids in the whole world are protected, and we're helping everyone with this. And so at that juncture in 1988, the World Health Assembly, which is all of the countries in the world, their health ministers voted to say we will eradicate polio. And also at that point, WHO, UNICEF, the U.S. Centers for Disease Control, and Rotary International joined and said, we're going to form a group that will make sure this happens. And they push forward with that. And that's this slide here. It shows the first four on the bottom, WHO, Rotary, CDC, and UNICEF were the first four joiners. The Gates Foundation, us, was the last joiner, and we joined. Well, we didn't exist in 1988 actually, but we existed by the 2000s, and that's when we joined. And Bill really saw this as an opportunity to give a gift to the world, where we had the tools, we had the capacity, and got behind it. And then Gates Foundation became a co-member with the other four.
We're going to talk more in just a little bit about who the people are who are delivering polio vaccine, but if you guys in the back, if you could have one of the cameras get a really wide shot of the audience, I'd like, if you in this room have personally delivered polio vaccine anywhere in the world, I'd like you to stand up right now, just as a show, or wave your hand in the case of Steve Crane. So in this room here, look at how many people, 1, 2, 3, 4, like more than a dozen people have personally taken polio vaccine around the world. That speaks to the power that Rotary brings to this fight. 1.2 million Rotarians all over the world, excuse me, 37,000 clubs. So basically, wherever there's polio, there's a Rotary club. And Rotarians have been delivering this vaccine. How key has Rotary's involvement been to eradicating polio?
Yeah, the Rotary role has been huge, and I appreciate this from a couple of angles. I was working with the polio program in India for 5 years, and there I could really see that having a local and national Rotary presence throughout India was incredibly important. Rotarians could actually talk to their governors and talk to their prime minister and talk to the folks around them and say, you know, this is an important thing, we have to do this. And they were a key ally for that. Rotary in the United States plays a huge role in Washington, again, carrying the message of the importance of polio eradication to legislators on both sides of the aisle, as they say. And it's been important for keeping the polio eradication initiatives as something that has actually bilateral support, even within the United States. So that's great. And of course, the final thing is the financial support, which has been key all along. And Rotary provided the initial financial oomph to the program, and now the foundation and Rotary are pretty much linked in trying to make sure that goes through to the end.
Yeah, we've got a match program with the Gates Foundation that's raising to the tune, if fully matched, $450 million a year. Is that right? Something like that.
Over 3 years.
300. Okay. A lot of money, but that's what it takes, right, to deliver this stuff. More money than I have. So I want to learn more about you, Jay. You know, I think about when we think about our vocation, when we go to work every day. You know, we have a task, we accomplish it. I've always admired people in global health because the job's never really done. We have some slides that support a little bit of your background, if we could go to those. So this is, I take it, your time in India. Yeah. I was reading some articles, and one of the stories that really touched me was you met a mother whose child was paralyzed, and it really hit you hard that here you are, a Western doctor, they're looking to you for answers, and it really hit you, the gravity of what these diseases do to families. Take me back to that moment and what that was like.
Yeah, I was in India for 5 years, and I was the program manager of their National Polio Surveillance Project, which was a program that oversaw where polio was and efforts to get rid of it in the entire country. And so as the chief, my folks would occasionally drag me out, and we'd go and see how the operations were going here, there, and elsewhere. And I got a chance to see and meet with a lot of parents and kids who got polio. And I guess the striking moment of that, and what is what sort of I think drives a lot of public health and preventive health people is when I visited a kid in Western UP, which is just north of Delhi, one of the last places in India to get rid of the polio virus. And they took me into this little house, which was one room, and the kid was lying on this wicker bed, and just like I don't know, maybe a 12 or 16-month-old, and obviously had a floppy leg. And so I examined the child and lifted the leg, and it flopped, and it didn't work right. It was clearly, this was a polio case. It had been paralyzed for a couple months. And the mother sort of looked at me and said, "Oh, what can you help us with? Can you help us with this now?" And the sad thing in that situation where this kid was now permanently paralyzed, leg would never get better, in a poor house with no money, and the mom looked at me as being the big doctor in charge of the National Polio Program, that I could do something. Well, and the sad part was I couldn't do anything at that point. We could offer a little bit of physical therapy and some crutches and that kind of thing, but you can't reverse polio. The only thing you can do is prevent it. The only answer to that problem is the vaccine and making sure that the polio program succeeds. And there are big success stories of people who had polio and overcame that, which is great. And I really admire those people. But to have a kid saddled with that as his entry into life is just the worst. And I think that the goal of the program is to stop that, make sure that never happens again.
Yeah, I think it was at the RI International Convention last summer in Atlanta, golfer Jack Nicklaus, I didn't realize, had overcome polio, childhood polio, and went on, of course, to an incredible career. Also last year in Atlanta, you kind of got to hang out with some rock stars, including, who knows who John Cena is in this room? Wow, you guys are hipper than I thought. We've got a little video to take a look at. One of the things about what the Gates Foundation and what others are trying to do is to raise the awareness of the importance of polio eradication, and they've done it really through a kind of a cool strategic network of famous people. So take a look. Here's John Cena.
We should do it. Checkmate.
从职业摔跤手转型成一个好莱坞电影明星，对这种转变你是怎么看的？
我不想改变我的工作，因为我最喜欢这个原因。
Hey Cena, they need you back on set.
哇，John Cena 真是无所不能。
好，谢谢。
谢谢您。
Hey, John Cena.
Hi, I'm Dr. Jay Wenger. I'm the director of polio at the Bill and Melinda Gates Foundation.
You know one thing I don't know a lot about? Polio eradication.
Yeah, polio is a bad disease that has been paralyzing and killing kids for thousands of years. Fortunately, we have some vaccines now that we've been able to use to drive this virus to the edge of extinction.
So there's no cure, but the vaccines prevent the disease.
That's right. Once you get paralyzed with polio, there's nothing that a doctor can do to fix that paralysis. However, we can prevent kids from ever getting infected in the first place by making sure that every child gets the polio vaccine.
With the help of the vaccine, we could possibly eradicate polio from the entire world.
That's right. We've driven polio now to the smallest populations ever, just a handful of cases in 3 countries in the world. Once we finish there, we win. But if we don't take advantage of that opportunity now, the virus could crawl out and reinfect other places again.
Doc. Donate to Rotary and learn more at endpolio.org.
So I'm just guessing that just totally raised your cool factor in the global health community. I got to hang out with John Cena. So
I was the short guy on the side there, just so you know.
Nice guns there, Jay. But yeah, Cena, if you guys don't know, he's it's kind of like the trajectory in Hollywood these days. You can become a big-time wrestler and then become an actor, and that's what Cena's doing. But at least he's using his fame for some good. In that video, it made mention of Nigeria, where there was an outbreak But let's talk about Afghanistan, Pakistan. Take us to on the ground, and we have a slide showing a healthcare worker. What are the real challenges in those two countries? I know it's very complex, but just from a really fundamental standpoint, what are the challenges there?
Yeah, well, when we talked to, the slide that you're seeing there is actually a polio worker. He's got the vaccine in that plastic, white plastic box, but he's getting across a tough river in northern and northeastern India, and it just highlights the extent to which the local healthcare workers will go to get vaccine to where they need to get it. I think that in Afghanistan and Pakistan, we're facing literally the last bastion of the polio virus, and it's there because in those places the kids are not reached by vaccines very easily, and the problems are different. In Afghanistan, we obviously have a problem with war. War is not something that stops the polio program necessarily, but it makes it a lot more complicated. And the polio program has been able to adjust to difficult and treacherous situations before, and there are a lot of examples of getting rid of polio in the middle of a war, and actually in Syria was the most recent and probably best example of that recently. But the program is employing a lot of different methods to try to take advantage of the opportunities there are to vaccinate kids, even in places where war is a factor. I think with Pakistan, again, we don't have a situation with war, but we still have an area where we have a situation where there are many areas that are not well served for different reasons by health care delivery, and kids don't get any vaccines. And to try to address the problems of the local parents and kids understanding what the polio vaccine is about, accepting it, making sure that the program actually reaches those last areas is sort of a management problem. So we've got a lot of work still to do to make sure that the teams which go house to house and knock on every door and identify every kid less than 5 and then put dewdrops into their mouth actually do that and actually know where they're going, reach every place, and reach every kid.
Let's talk about some of the innovations. The thing that I didn't really know until I started learning more about polio is that it's not just you're going like parachuting in and dropping vaccines and saying see you later when everybody is polio free. What's happening at the same time is that when we go into these countries with this global partnership, we're creating an infrastructure that doesn't just serve polio, it serves a lot of other things. So Jay, give us an idea of what does that infrastructure look like in these countries and the real benefit of it. So we're not just ending polio, we're actually raising the whole country, aren't we?
Yeah, that's true. And I think that part of the issue with the polio program now is that it has been successful in nearly every country in the world. So in many countries, we're at the point where the polio program did its thing. India is a good example. They set up a system that could identify cases of disease, had a good laboratory system to back it up, had a good response system to where if they needed to, they could rush out and do a campaign wherever it was. In India, what we're working on now is to make sure that infrastructure, that those trained people can now be used to do other things. So even when I was there a couple of years ago, we would get calls from the government saying, oh, I hear there's a case of Japanese encephalitis or there's an outbreak of something weird going on in the north of the country. Could you get your guys to check it out and see what's going on there? And so we would do that. We would redeploy our folks and use that capacity, that polio capacity, to look at other diseases. In Nigeria, during the recent Ebola outbreak, which you may have heard about, which occupied in West Africa a couple of years ago, there was a threat of it coming into Nigeria, and actually a person with Ebola did come into Nigeria. It came into Lagos, the capital, and we got a call from the Nigerian government saying, could you loan us some of your polio people to set up the same kind of emergency operations center for Ebola that you did for polio? And so we did that. We loaned them the people. They stayed there for 6 months. They set up the system, and they basically stopped Ebola in Nigeria before it went wild, which was great because Nigeria's got it has the biggest population in Africa, and if it would have gone wild there, would have been in big trouble. So those are just two examples of where the polio infrastructure has been used to do other things. And so as we talk about the polio program and getting to the last part and actually doing it in general, we weren't just developing a thing just for polio, but we've actually developed a system and ways of doing things that will be used and are being used for lots of other diseases.
Let's move on to how the virus is tracked. I read that now you guys are actually sequencing the viruses to understand exactly the DNA component of a particular virus. So talk about what that is and how does that lead to tracking it and ending it?
Yeah, we have a couple ways to track polio, because the program needs to know where it is in order to know where we have to do a better job with vaccinating. And we do it two main ways. One is if a kid is paralyzed anywhere in the world, there's a system now that helps to connect so that kid will get 2 stool samples taken, and those stool samples will get sent to the laboratory chain, and the lab will culture it and look for poliovirus in it. That's the one thing. The other thing we do, which the picture was about before, is we've now gone to places and actually tested the sewage. So not looking for any kids at all, but just saying, okay, if we really think Mumbai doesn't have any more poliovirus, let's keep checking. So they get a gallon of raw sewage, which is in many of these places actually just out in the open, and ship that to the lab, culture that, see if there's any poliovirus in there. And that also gives us a good way to find it. But when we do find a poliovirus, in the laboratory, they sequence. They do genetic sequences, basically like Ancestor.com. And so we can see that this virus that I just got from, Jalalabad or something, its most close relative is one that actually came from 10 miles down the road, or 20 miles, or maybe came from a different country. And so we developed these trees which help us assess how the virus is moving and where it's going. And that is very important for us to be able to know where our weak spots really are.
Wow, that's pretty wild. You guys have also come up with other technologies using GPS, things like that. Talk about how technology has helped in the fight against polio, because in the old days, you had to take someone's word that they delivered vaccine, right? Or covered certain geographic areas.
Yeah, right. So we've been fortunate, as we said, the polio program has been going on for a while, so technology has developed while we've been doing it. And we've adapted a lot of things that have helped the program move along. One very simple thing is mapping. When we first went to northern Nigeria, the only maps we could find for a lot of these areas were maps that were made by the British back when Nigeria was a colony, which was like 60 or 70 years ago. So those were really out of date. And so we were able to provide maps using satellite imagery, which basically were up to date, and we then gave those to the team so that they could develop their plans for going around from village to village and actually make sure they got all the villages. And in that operation, we actually identified, another 10% of villages above what we were already going to, which people had not really realized existed or not really recognized before. So that's one thing. We're also using a lot of techniques which are sort of like reminder techniques with using cell phones, where we have apps now that are given to the surveillance people in some of these key countries, reminding them that they need to go to their local hospital every Saturday and check to make sure there are no paralyzed kids, and check a box if they did find one. So lots of what we would, I guess we've been able to adapt a lot of the currently available technology to this particular program, and making sure that we can make these things work better.
What keeps you going? I mean, this is a big, big task. What benchmarks in your life do you look to, or just from a day in, day out perspective? How do you stay motivated? What keeps you going?
Well, that's a good question. I think the goal is huge, and I think that I look at polio eradication as being a real concrete accomplishment. You can do a lot of things. You can attempt to do a lot of things, but polio eradication is actually a clearly measurable endpoint, where when we get to the end of the virus, we'll know it. And it's also something that's a gift to every kid in the world. Going back to what we were saying in the beginning, it's not saying, oh, we got a new vaccine, people should get it to prevent something or other. It's that here we have a thing that can stop this disease in every kid in the world, and it doesn't matter if they're poor or rich. In fact, we were singing "It's a Small World After All," at the beginning of this meeting, and that made me remember. I mean, going through that Disney World thing where you go and you see all the people in all the different countries, and you say, "Oh, that's cool." Well, the neat thing there is every one of those countries, down to the last two, has actually done everything they need to do to get rid of polio. And if we can get to the end, we'll protect not only the rich kids, but also all the poor kids, who we can't really guarantee that we're always going to be able to give them all the vaccines that they need. But if we get rid of this virus, we can actually save them from this thing. And that's actually probably one of the main things that drives me. It's real, and it's measurable, and it's a gift to all those kids.
Yeah. There may be some new parents watching on the live stream, Jay. Kids still are given a series of shots to immunize against polio in this country, correct?
Yeah, that's right. The United States started out with the Salk vaccine you saw in the picture, and then they switched over to the droppy vaccine, and then switched back after the viruses went to almost nothing to the Salk one. So every kid in the United States right now gets at least 4 doses of the IPV, the injectable polio vaccine, and that's basically what will protect them in case, in the odd occurrence, it would come back somewhere, or come in from one of these other countries where it still is.
We have a slide with a quote from Bill Gates. I'd like to put that up if we could. It's right there at the end. What I think is exciting about the fight against polio is this is a team sport. And here's what Bill said. This is what is so exciting about Rotary's 30-year fight. Not only are you eradicating one of the worst diseases in history, you're also helping the poorest countries provide their citizens with better health and a better future. And getting to zero is incredibly inspiring as an achievement of humanity. What really is encouraging to me, Jay, is that when we look at what's happening in this room and around the world, especially on World Polio Day, is that there are some big players who have stepped up, and there are some little players who've stepped up, and it's amazing to see this team that has evolved. So on behalf of Rotarians all over the world, we're grateful for what the Gates Foundation is doing to fight polio, because there are a lot of problems in the world. This is one that you guys have dedicated yourselves to, and we just want to thank you for that. And I'd like to, with that, wrap up our live stream on the platforms of King 5. You guys, later today, Rotary International is doing a live stream at 3:30 Pacific time. Is it endpolio.org? Yeah, so endpolio.org. You'll see about a 4-minute interview I did with Leah Hegg. She's a senior program officer at the Gates Foundation on polio. That's going to be on a part of the global live stream from Rotary International. But Jay, I just want to say from all of us, thank you for the work that you're doing, and from the Gates Foundation, you guys, thank you for all that you're doing to help end polio. Thank you so much. Thank you. So now that the live stream is over, we can really, pull out all the stops. I'm kidding. I'm kidding. Yeah, let's go to some Q&A now. Love to hear from you guys.
Question here from Charlie Dickey.
You mentioned.
Sorry, Derek. Go ahead.
You mentioned that the United States has switched from injectable to oral and back to injectable. Can you tell us a little bit why, and whether or not other countries are following that?
Yeah, well, that is a good and slightly complicated question to answer, but I'll try. The injectable vaccine was the first one that was developed, and in 1955, the same year I was born, and everybody was extremely eager to get it. It was given in mass campaigns and given as quickly as they could develop it, as they could make it. thing about the injectable vaccine is that it's made from killed viruses, and if you inject it in a kid, it will give them antibodies so that if they swallow the polio virus will be in their stomach, and they will still maybe excrete some and reproduce some more polio virus, but it won't actually cause the paralysis. So it protects them from paralysis. It doesn't exactly protect them from the virus itself, so they can still transmit the virus onto the next kid and the next kid. And if it ultimately gets to some kid that didn't get vaccinated, then that kid could get paralyzed. So IPV was a good thing to stop the paralysis. It wasn't a great thing to get rid of the virus. The oral polio vaccine, which is the one you take in the drops, that one goes into your stomach and makes your stomach immune after you get enough doses. And that one, if then a kid who's gotten that vaccine swallows the bad virus won't go anywhere, and it sort of stalls out. So when we actually want to get rid of the virus from a country, we use the oral polio, the OPV vaccine. If we're just sort of doing protection insurance, we do the IPV. What's happening globally, and the reason that the United States switched was that after we used the IPV and then went to the OPV to get totally rid of the virus, they still noticed that there are a couple cases a year of polio. Like I said, we went from 50,000 cases in the United States to 10. And when they looked at those 10 cases, they found out that those 10 cases were actually traceable back to the oral vaccine. And people figured that even though, because the oral vaccine can mutate a little bit sometimes in the wrong situations and cause a problem, which you hear about occasionally. So the only way to stop that is, or the logical way to stop that is to not use the oral vaccine. So after the disease went down to all the wild virus was gone in the United States, they switched back to the IPV mostly as an insurance thing, and that's what kids are getting in the United States today. In the grand scheme of things, we are going to, once we get rid of the wild polio virus in Pakistan and Afghanistan, we will stop all of the oral polio vaccines in the world and have everybody go on IPV. We've started that process to now every country is giving a single dose of IPV. And the foundation is working a lot on making some cheaper IPVs. The other problem with IPV is it costs a lot of money. So in developing countries, they couldn't use it very well. We're trying to fix that. But that's still a work in progress. But the ultimate deal is we'll turn off the oral vaccine and then get to the everybody using IPV for a while.
Jay, a couple of related questions. First, related to quantity. The proportion of kids in Pakistan versus Afghanistan. And the second question is, particularly in Afghanistan and the war-torn areas, you'd alluded to that you might employ special techniques to get to the kids in places like that. Could you elaborate a little bit more on that?
Yeah, I could. I don't quite. The first question, though, was what?
How many of you said? I think we're 22 kids this year.
Yes,
and
right.
How many of them were Pakistan? Maybe you said it and I didn't hear it.
Yeah. No, I didn't say, but I think most of them this year are actually in Afghanistan, like 16, yeah, and that is that's in two places. One is in the Helmand Kandahar area, which is in the south, and that's a big that's a problem area. Because of the war, and the other part is up in the east part where it's another problem area for a slightly different reason, but both of those are sort of war-affected areas, and most of the cases have occurred in places that are technically under the control of the anti-government elements, if we'll call them that. And so what we're doing in those places, so I'll say that. So most of the cases happen to be from Afghanistan this year, but ironically, Afghanistan is a place where 2 years ago, we actually got rid of all the virus in Afghanistan. So all the virus that was sitting there and all the families, all the genetic families, killed it all off. There wasn't any virus in Afghanistan, but then they got reinfected from some of the places in Pakistan, because that Afghan-Pakistan border is very porous. Their Pakistan population is much bigger, and there are some foci in Pakistan, Karachi, in the south, which is the biggest city in Pakistan, and Peshawar in the north, where we always have people, well, it's been very difficult to reach those populations consistently. So although you will read that there are more cases in Afghanistan and Pakistan. We're really looking at that as, quote, one epidemiologic block. So there's a link in the south between Karachi, in Helmand and Quetta, Pakistan, and there's a link in the north between the eastern Afghanistan and western Pakistan, and the people are sort of cycling around there. So there's been a lot of effort to, one, make sure there are transit site vaccinations that are operating all the time, which are posts along the road where they stop travelers and vaccinate them. Make sure that we are identifying migrant groups and making sure that the migrant groups that rotate around there are that people know what time of the year they're going to be in and what time of the year they're going to be out, and so that they can make the program go to the places where they are and vaccinate those kids. And then there's a big effort to make sure that they work as closely as possible negotiating access. And that's in in Afghanistan, that's a big effort right now. And it is possible to negotiate with most of the anti-government elements. Because as you remember, the groups that are the biggest anti-government elements right now used to be the government back before 2011. And yeah, I mean, so there's ways that you can sort of, they are negotiable. So there's a lot of that kind of work going on.
All right, so that is all the time that we have. We're really proud of the relationship that Rotary has with the Gates Foundation. We're so glad that you're partners in this fight. Thank you, Jay. Thanks for being here today, and thanks to the Gates Foundation. Thank you, guys.